Okay, we are live, and our topic today. This is on YouTube as well as Periscope. We are live talking about rhinoplasty. And for those of you viewers out there who have never been to a physician to talk about your interest in getting a nose job, this is information for you out there. Those who are anxious about going to your first rhinoplasty consultation, either with myself, Dr. Tansavatdi, or anybody else, any other physician out there, any plastic surgeon, you want to get to know all this information today that I'm going to be talking about. So first things first, I would say you need to know when you are researching, even before you come to your rhinoplasty consultation, who you are seeing. So that person, that physician, needs to be a plastic surgeon that is either board certified with the American Society of Plastic Surgery or the American Board of Facial Plastic and Reconstructive Surgery. If you want to know how many rhinoplasty surgeries that surgeons perform, they should at least perform 1 to 2 a week. If they're doing less than that, then they're not doing enough nose surgeries, and you should be cautious of who you go see. Some plastic surgeons focus on one area more than another. So some plastic surgeons will focus on the body. I focus just primarily on the face. So I want you to know that that means that the majority of my cases are nose surgeries, facelifts, eyelid surgery, and anything else in the face and neck. So that means that I do at least 1 or 2 nose surgeries per week. And you should look for a surgeon that does that frequent number of surgeries. Why? Well, you need somebody who has that expertise, because nose surgery is probably the hardest surgery on the whole body to get correct. So tiny few millimeters of difference will make a difference on the nose, and you can have actually different techniques. There's an open versus a closed technique. So for those who don't know what an open versus closed, it means open means we make a little incision at the bottom of the nose and we flip the skin back and we can see the entire nose. That gives us a lot of advantages. For me, I like to perform a majority of my cases open because I can see everything. The downside of that is that you have more swelling after the surgery, and so there's more recovery. I can also perform a closed rhinoplasty, and in those cases I probably do that about 20% of the time. A closed rhinoplasty is perfect for those who have just a bump on the nose or some tiny tip deformities that we need to take care of. If the tip requires a lot of work, if there's a lot of rotation, or we want to define the tip more, then I like to do that via an open approach. And so your surgeon should know both techniques. I would not go to a surgeon who just does one technique for everything, nor would I go to one that doesn't know which technique to use. So I would be familiar with your surgeon, what kind of technique they use, and that's one question you should ask. The other question you should probably ask is how many surgeries they perform. I talked about that earlier. And then when they last performed their last rhinoplasty. You also want to look, you want to ask about their revision rates. This is something that you don't think about at the time and might think about later. The typical revision rate is anywhere from 6 to 10%, 10% a little high, but the average is about 5 to 8% in terms of revisions. You also want to know what their policy is. Your surgeon should have a policy on revisions. My policy on revisions is that if I feel it can be taken care of and is related to the first surgery, then I'll take care of it. If it's related to just as the wound heals, and if there's some scarring or something that happens as a result of the patient's healing process, then that is something that I would charge for. Also, you want to know how long it's going to take for them to do the procedure. Some people can be really quick and takes 1 hour. With that, sometimes I'm a little bit leery because they're doing the same procedure every time for each surgery. So they all look similar. And actually, rhinoplasty is the one that you really want to fine-tune to the patient's nose. And so each one is customized. Each procedure that I do is going to be different and a little bit different in every way for each patient. So they're not all the same. And you need somebody who knows what they're doing. The other thing I would look for is to ask your surgeon for a morph. What is a morph? A morph is they can take the picture that they've taken in the consultation and modify it so they can show you exactly what they expect your nose to turn out. It's a good tool because it allows you to discuss with your surgeon, because you may not have the same idea or concept of how your nose would look, what you would like it to look like, and your surgeon may think you want it a certain way. So if you can have that discussion and that surgeon can modify the picture to get to where you're both comfortable with how it's looking, then he or she, your surgeon, can understand what you're looking for and create the perfect nose for you. So that is important to do with your surgeon. The other thing I would do coming to your consultation is to look at noses that you find are attractive. Of course, you have got to be reasonable on what could fit your face. We don't want you to take a look at, let's say, taking my nose and putting Jennifer Aniston's nose on me or Angelina Jolie's nose on me. That wouldn't work. It wouldn't fit my face. So, but if you look at noses and faces that are typical to you out in the media and you say, hey, I like this nose, bring a picture of that to your consultation, because it will help to get the discussion going with your surgeon to know exactly what you're looking for. Also ask your surgeon what kind of anesthesia to expect. So I typically do this under general anesthesia. If I do any bony work, that's cracking the bones, that's going to be painful. And you want to have at least either a deep sedation. Twilight's okay, but I prefer general anesthesia. Patients are comfortable that way, and they wake up. They can be. I can put in some long-acting anesthesia during the injection process, so patients are comfortable for the whole day duration, and later that night they'll need maybe some pain medications. Also, you should ask to see before and after cases. Of course, you know there are cases sometimes on the internet that you can see on their website, but a lot of patients are very scared to show their pictures online, and so it might be helpful, even though you don't see the pictures that you want to see on their website, is to go for the consultation so you can see their before and after pictures that maybe are only available in the office. And you will find that is the case for a lot of cases that involve the face, because patients are not willing to share their picture all over the internet. So that's something important to ask your surgeon.
It just got a little glitchy.
Okay. Are there any questions, comments? Okay. All right. And so that's a majority of what I wanted to talk to you about today to prepare for your consultation. The other thing that I would do is, there is a price range that people will talk about. I'm not going to talk about the details exactly of what we charge here. It really depends on the time that it takes for the surgery. Some are more complicated than others. And the range can be anywhere from $8,000 to $12,000 here, and then range up to $15,000 or more in Beverly Hills or other locations. But I do want to address that there was a comment by one of our subscribers out there. I think that's 415 Life was out there, and they had commented wanting to know what the price we charge for rhinoplasty, and that is what I would say our quote for the range of what we charge, anywhere from $8,000 to $12,000, depending on the complexity of the case. Also, if it's a revision case, it requires more work, more time, and more expertise. So don't go to just anybody for your revision rhinoplasty, and that would cost a little bit more than the actual range for the first rhinoplasty. Okay, well, thank you for all your comments out there. Please continue to put up comments for us so that we can know what questions to answer, and we'd be happy to answer them. I'd be happy to answer them at another talk. Okay, thank you for tuning in, and we'll see you this Thursday. I'm going to be doing a preview of what our next topic will be for the following week, next Tuesday. Tune in every Tuesday at this time, 12 o'clock noon, on our YouTube channel at Faces by DRT1 and Periscope at Faces by DRT. And I hope you have switched over now to our new channel on Periscope. It used to be at Kristina Tansavatdi, but it is now at Faces by DRT. All right, thank you very much. Bye.